In part 2 of chapter 11, we're going to talk about power, the functional movement screen, and some other considerations to take into account when you're selecting appropriate performance-related fitness tests. In part 1 of chapter 11, we talked about measuring agility and coordination. Now we're going to talk about measuring power. Power is the ability to generate maximum force in a minimum amount of time. Sometimes this is called muscular power, which is a subdomain of power. It's also known as anaerobic power. This is unique to certain body regions, specifically arms and legs. We have various field methods in order to measure power, along with laboratory methods. One of the most common laboratory methods is the Wingate anaerobic test, and some common field methods include the Margana-Kalaman power test, the standing long jump, and the vertical jump. See chapter 10 for that vertical jump test that we went over previously. So the Wingate anaerobic test is one of our most common laboratory methods to measure power, and this is used to measure anaerobic power of the lower body. Regarding scoring, this test provides mean and peak power as well as a fatigue index. One of the most common field tests to measure power is the Margana-Kalaman test. And this test shows the power of lower extremities. And for scoring, power is calculated from the formula below. Here are the more detailed instructions of how to execute this test. One of the next field tests used to measure power is the standing long jump. This is to measure explosive leg power. For scoring, you record the best of 3 trials in feet and inches to the nearest inch. These specific instructions are on the next slide. Here we have the specific instructions for the standing long jump test, as well as the performance standards. Next, we're going to talk about measuring reaction time. Reaction time is the interval between the presentation of a stimulus and the initiation of the response. The person's quick action ability is assessed by reaction time. Very recently, apps for finger touch reaction time tests have been developed. These include things like the Reaction Test Pro and Lights Out Reflex Test. One way to measure reaction time is the Nelson hand reaction test. This is used to measure the speed of reaction and the hand response of a visual stimulus. This is done by taking 20 trials where the clinician stands in front of the patient with a ruler just above the patient's hand, and then the clinician drops it and the patient is instructed to pinch the ruler, and then you measure where they pinched. You throw out the 5 slowest and the 5 fastest trials, and then you average the middle 10, and then you record the mean distance that can be converted to time using the table that's available in your book is figure 11.4. Our next component of performance-related fitness is measuring speed. So speed is the capacity of the individual to perform successive movements of the same pattern at a fast rate. Speed concerns many body parts and may vary from body part to body part. Speed is essential for successful performance in many motor activities. One of the most common examples of measuring speed is the 50-yard dash. This is used to measure speed. Scoring the better of 2 trials is recorded to the nearest second. When we think about speed, most of the time we just think about leg speed in running activities. However, speed of movement can be improved through training and proper technique and through practice, and can be used and measured in our upper extremity as well. Here is the full instructions for the 50-yard dash. One of the other performance-related fitness components is kinesthetic perception, which is the ability to perceive the body and space involved in sport performance. However, this is the hardest to measure in terms of reliability, validity, and objectivity. There are also a variety of performance-related fitness tests that look at multiple different components. One example of this is the functional movement screen, or FMS. FMS consists of 7 fundamental movement pattern tests. These include the deep squat, hurdle step, inline lunge, shoulder mobility, active straight leg raise, trunk stability push-up, and rotary stability. For each of these tests, it's scored on a scale of 0 to 3 with a maximum of 21 points. When we're looking at this test, there has been research to indicate that a score of 13 or below can indicate greater odds for sustaining an injury compared to scores 14 or higher. The functional movement screen is a screening tool to evaluate movement patterns. This is used to improve movement in healthy individuals. And in order to be successful, one needs to have stability and mobility. The next few steps will break down the specific FMS movements. One thing to note about FMS is that each movement is scored on a 0 to 3 scale. However, this system does require training on correct movement patterns and scoring, and the training also provides modifications for the exercises, and it does require some equipment. This YouTube video does a pretty good job breaking down all 7 of the specific FMS tests and is something that I would recommend viewing. On the next few slides, I'm just briefly going to talk about the 7 different FMS components. You can read more detailed information on the slides at your leisure. The first part of the FMS is the deep squat, and this deep squat pattern challenges total body mechanics and neuromuscular control. Next is the hurdle step, and this challenges the body's step and stride mechanics. This is a test that's also done bilaterally. Next is the inline lunge, and this pattern places the body in a position to simulate stresses during rotation, deceleration, and lateral movements. Next, we have the shoulder mobility test and the active straight leg rise. This pattern not only identifies the active mobility of the flexed hip, but looks at the core stability within the pattern, as well as the available hip extension of the alternate hip. We also have the trunk stability push-up, and this is used as a basic observation of reflex core stabilization and is not specifically a test or measure for upper body strength. So it's for core, not upper body. The final test of the FMS battery is the rotary stability test, and this pattern observes multi-plane movements for the pelvis, core, and shoulder girdle, along with stability during a combined upper and lower extremity movement. Transitioning out of specific tests, when we're looking to evaluate performance-related fitness, it's important that we select an appropriate fitness test. One thing to think about is validity and reliability. Do you remember what reliability is? Reliability is if the test is consistent, and validity is does the test measure what it's supposed to. When we're thinking about validity and reliability, we prefer a test with a validity and reliability coefficient of 0.8 or higher, and that could vary based on the nature of the performance test, such as 7 may be acceptable, or 0.7 may be acceptable for tests requiring significant skills. One test that requires significant skills is the hair circuit test. That requires a lot of significant skill with the jumping and making sure you're facing the right direction the whole time. Some other factors to think about when we're selecting the appropriate fitness test are sex, age, ability level, familiarity with the test, and how that may impact validity and reliability. And we want to consider other secondary features related to practicality. Things like expense, time to complete, space needed to complete, the number of test administrators needed, or the objectivity of the scores. Some features to consider when you're selecting the appropriate fitness test are whether it's easy to administer, how much equipment is needed, can it be done in a group or not, what is the length of time needed, who can administer it, is it easily and objectively scored, And we want to use these features to select the most appropriate test based on our specific situation. As we had talked about in Module 10, when we're administering fitness tests, we do have some preparations that we need to take into account. One is the need to understand instructions. That's important from the clinician and the participant's point of view. You want to make sure you're demonstrating in slow motion and then again in real time. You want to have the participant walk through the test to make sure that they understand exactly what they need to do. And then you can always give them the opportunity to practice at full speed as well. This will help to ensure more reliability with the scoring. Some other things to keep in mind is preparation for testing. You want to prepare properly for testing, and it takes longer than you think it will. Don't assume anything. You want to bring assistants together for practice sessions as needed and review and demonstrate the tests. You can also conduct a brief review of the procedures. Remember that with these performance-specific tests, the goal is not to measure the ability of a novel task, but the participant's true ability. No one test can measure all of the components of fitness. Some tests are very specific, so how the participant does on one does not indicate how they might do on another, even if they are measuring the same component. So how somebody does on one agility test may not indicate how they'll perform on a different agility test. Just using one test to measure a component may not be the best representation of that person's ability. Some last things to consider are the number of trials that you need for specific tests. You want to make sure to determine how many trials are needed for obtaining a reliable score, and you want to aim for the target reliability coefficient of 0.8 or higher. Use norms when available. Remember that norms or percentile scores can be helpful to describe and interpret individual performance, and many norms of commonly used performance-related fitness tests are outdated. So you should have caution when you're using these norms to take into account. In summary, between Part 1 and Part 2, we talked about the tests of performance-related fitness and introduced the differences and similarities with health-related fitness. We also talked about key components of performance-related fitness, and then selected tests for each component were introduced. We talked about the functional movement screen, as well as critical issues related to administering and using fitness tests were also discussed. The following slides are a few review questions for this chapter.